Hi, it's Dr. Isaac Kuyunov here at Dental Prosthodontics of Rochester, and I'm going to discuss today about how to choose your right implant provider. What are the credentials of a provider? In dentistry, most people, to become a dental provider, you have to go through a dental school, complete it, take the boards, and then you become a dentist. And after this, mostly is continuing education. Continuing education such as could be a few months, could be a weekend. However, some of us continue into a more structured education. This could last between 2 to 3 to 6 years. To become a prosthodontist, you have to go to school. It's a full-time school. It's 3 years of extra training, and during this training, a lot of aspects of dentistry are being addressed. With prosthodontics specifically, it's about how to replace missing teeth and how to address complex cases. And in the last 20, 30 years, it has been developed into how to incorporate dental implants into this treatment. So most prosthodontists have a very good and solid training with dental implants. It is important to really know your provider that they have really good, solid skills with dental implants. With a prosthodontist, when you come to our office, please ask for before and after pictures of patients that were treated. It's very important to see where patients are starting and where they are finishing. And when you have this before and after, and you have a lot of those, then you can understand what can be done. Many times, patients don't even believe that something can be done for them. They kind of like throw the towel. They stop believing that there are options for them. Please come and ask, and let us show you what can be done, because nowadays dentistry is so advanced. We have so many solutions, and we can provide these solutions. We'll be happy to share those insights with you and tell what can be done. And we can show you some cases of before and after patients, and this can be really incredible solutions. What implants, brands, and technologies that are used, and why? So there are a lot of implant brands outside, and some of them have a lot of research on them and very commonly used. In my office, although they're like I do see patients with different implant brands, I do believe in some of them very strongly, and they are being used, and they have a lot of research behind them. And just to mention a few of them are Straumann, Nobel, and BioHorizons, Zimmer. These are all well-known implants. It does not say that other brands are not good, but there are other implants. There are many implant brands in the market. Some of them have a lot of research in America, and those are the ones that ideally I would prefer to use when I work with dental implants. In terms of technology, it's well developed now. We don't really do implants with our eyes closed. It has to be well planned ahead of time. So there is a lot of preparatory work that goes into it, and it means taking proper images. For example, a CBCT. This is a cone beam CT. That image is not a two-dimensional X-ray. It's actually a three-dimensional X-ray that gives a volume of bone volume that the patient has, and this gives a lot of information: what type of implant can be used, how big it is, and do we have enough bone volume to place the dental implant to be there successfully and serve our needs long term for many years. Sometimes just based on this image, we see that there is just not enough bone, and before we can place dental implant, we have to do some other work, such as bone augmentation and increase the bone volume before we can place the implant. Before we jump into any treatment, we really have to plan the case properly and use all diagnostics data that we have to make it safe and predictable long term. What is included in the price, and are there any hidden fees? Truthfully is that there should not be any hidden fees. The proposed price should include everything, and it should be one price, and it really depends. So if there are bone grafts that are needed, you should know about it ahead of time. Now, if there are number of implants that are needed for you is 4, and you require 6, you should know about it ahead of time. So the cost that you will receive usually will have everything in it. Now, one thing to remember is that there is a surgical cost and there is a prosthetic cost, and sometimes it's being separated into 2 parts. If you see a surgeon outside of our office and the surgeon gives you his surgical fees, this only includes the surgical fees, does not include the teeth that go over the implant. In our office, we'll then provide the prosthetic fees, and you will have a full picture of surgical and prosthetic fees together. In the most part, we'll guide you through everything, and we'll make sure that you are fully aware of the full cost and treatment time and what it involves. We'll give you all the information that is needed so that there will be no surprises or any hidden fees. Do warranty or guarantee is being offered on the restorations. So ideally, we want to do everything that is going to last for many, many years for all of our patients. If something does not work in the first year, that's definitely on us, and we will take full responsibility for this to address it and make it work. It rarely happens. It's a very small percentage that happens. It has been reported in literature that dental implants don't really have 100% success. There is some percent of failure, and this usually is 2%, 3%, 5%. It really depends what study you are going to quote. But for the most part, they are successful. And if something happens, it's really on us. Ideally, we want to provide a treatment that will last for over 10 years. That's our goal. It's over 10 years. So up to 5 years, we have to make sure, okay, if something goes wrong, what went wrong? Did we miss something? After 5 years, it's a fair game. But my goal is 10, 15, 20 years because you are going to go through, you'll put your time and your money into it. It's a big investment, and we want to make sure that you will get the best possible outcome of it. I hope I was able to answer some of your questions. If you would like to schedule an appointment with us, don't hesitate. Reach us at 585-471-5689. Thank you.